All right, chapter 22, video 3. Back to where it comes to spinal cord injuries. So, if I've got a complete spinal cord injury, then I will lose sensation and movement from there down. All right, and then I could have spinal cord injuries that are partial, that I might lose some of the function, and sometimes I get a little bit of that back. Just depends on how bad the spinal cord injury is. Signs, symptoms, and diagnosis. A complete severance of the spinal cord or damage in the cord's entire thickness results in a total loss. I'm really going to lose sensation, movement. I always talk about Superman when we talk about this, because I can't exactly remember where he had a horse accident. Do you remember where Superman's injury was, Eric?
What?
Do you remember where Superman's injury was? C2? I'm almost positive it was C2. So he lost everything. He couldn't breathe on his own. I almost think that he ended up passing away from severe infections from decubitus ulcers that he had. But he lived for quite some time like that. All right, so I'm really going to be looking at if it's a complete loss of sensation and feeling and movement from there down. Make sure you know the words tetraplegia, also called quadriplegia. That's severe injury to the cord above the level of the fifth cervical vertebrae, often is fatal. So, I mean, that's what Superman had, but, you know, he had lots of money. So, also know paraplegia. That's also an important one to remember. You got a table 21.1 that talks about levels of injury. That's a really, really good one to look at, okay? It really is a great one to look at, but if you can just remember, if you don't quite get a hold of that whole box right there, think about if I was looking at a visualization of your spinal cord and all of the nervous system that comes off of at each area, and think about if I had an injury there, think about where your vertebrae are, and just about everything from there down, you'll lose sensation if you have a complete injury. Okay. Treatment, number 1 is to make sure you're alive. Okay, some of these injuries are so high that they're incompatible with life, but medical advancements are amazing, so we've kind of got past that. But, I mean, you have to think, I don't know. That's ethical. We won't go into ethics. Prevent further injury to the cord by carefully handling the patient, so that means that I'm not just tossing them around, all right? If I'm definitely getting braces on them, especially a cervical collar. If I have to move them after I get them in the hospital, I'm definitely log rolling with more than one person. If I go to pull somebody over in the bed with a pad, I don't move their whole body at one time, so I'm going to need multiple people to log roll. Repair as much damage to the cord as possible. Establish a routine of care that will improve and maintain a patient's state of health. Remember, after the surgeon gets done with them, if they can do anything, then I'm the one that's with them after the fact. You might be working in a rehab facility that helps these people try to get back some function, or at least learn how to live with the loss of function that they have. Always look at your red safety alerts. They're always important. You've got a bold section right at the bottom of 512 and the top of 513 talking about stabilization of the neck. Pay attention to that. The use of corticosteroids in these injuries. Also pay attention to this. Normal saline is used for fluid replacement, and drugs such as dopamine may be given to sustain sufficient blood pressure to prevent hypoxia. Okay, that's an important one. Respiratory management, that's going to be a tricky one. That depends on exactly where the injury is. Like I said, Superman's injury was so high. I'm pretty sure it was high enough that he was ventilated for the rest of his life. I can't hardly remember, but it just depends. If my injury is high enough, then I don't have the nerves to be able to breathe. So these people may be ventilated, probably have a trach eventually. So I definitely have to worry about the respiratory status. The people with high high spinal injuries are those people who have pneumonias constantly over and over and over. All right, remember, if I'm stuck in the bed, I can't breathe good on my own, I'm not up walking around, pneumonia. Immobilization after surgery. Cervical spinal cord injury is usually treated with traction. to immobilize the affected vertebrae and maintain alignment. So that doesn't mean these patients get to move around. That means that when after the doctor fixes it, it needs to stay exactly straight or however the doctor puts it. So we're probably going to be using traction. There's some pictures in your book about traction. You've got a halo on one page. You've got a vest, a spinal vest, and how that, I'm telling you, that would have to be rough to wear. But, all right, urinary management, I'm probably going to have a Foley catheter in. The rest of it, grieving and mourning is always going to be huge. Remember when you get to these tests that you're looking for those open-ended, how are you feeling kind of questions. I'm using empathy more than sympathy. All right. So I'm looking at, I understand, or I can see that you're upset today. Can you tell me how you feel? Those kinds of answers. Make sure you're paying attention to spinal shock. You don't see it a lot, but you're definitely going to see it again. I don't know if it'll be on his test or this test or whoever's test. It may not be on the NCLEX, but you might see that sometime in your career. So look at spinal shock, what the symptoms of spinal shock are, and how to treat spinal shock. I don't know how much drugs you need to pay attention to. Definitely remember your corticosteroids, though, because I'm going to use corticosteroids almost always, okay? Remember that mannitol if I have ICP, because that mannitol is actually fluid. It's going to help me pull, by osmosis, fluid off, all right? And you do have a paralyzing agent down at the bottom of that on 519, and, you know, that's just so I can keep the spinal cord in position. Autonomic dysreflexuria. Autonomic, or AD, dysreflexuria is an inhibited and exaggerated reflex response to the autonomic nervous system to some form of stimulus that occurs to 85% of all patients who have spinal cord injury or above the level of the 6th thoracic vertebrae, or T6. The AD response is potentially dangerous to the patient because it can produce vasoconstriction of the arterioles and immediate elevation of blood pressure. Hugely important. You will probably see that again. Autonomic dysreflexuria. I almost think that if you ask Nurse Royston, I left a book there that has a little picture on it about AD. But know that it's exaggerated. And my big problem when it comes to AD, even though it's an exaggerated response, is that elevation of blood pressure. Clinical cues is also important. It's talking about distension of the bladder. Of course, I normally have a Foley in this state. Orthostatic hypotension, that really depends if I've got somebody up moving around, so pay attention to that. A DVT, a deep vein thrombosis, is going to be a huge one for anybody stuck in the bed. I'm always looking for those clots. Infection is going to be huge, especially a lung infection. Skin breakdown, huge. I'm almost positive that's what Christopher Reeves passed away from. Renal complications, because my bladder may not work anymore. Depends on where the injury is. If I don't have a bladder that works anymore, then I'm probably going to get numerous bladder infections. The rest of the chapter looks like it's pretty much taking care of that patient. There's rehab. It does talk a little bit about a slipped disc, and that's pretty self-explanatory. But if you look at that picture, you can see if that slipped disc, where it goes, I'm putting pressure on something else. Sometimes I could put pressure on the inside, so pay attention to that one. I do have highlighted on this other page when it comes to a slipped disc that some of the best things that patients can do is walking for short distance and swimming. Swimming is fantastic for anybody with back problems, including pregnant women, because it takes a lot of pressure. It gets you exercise, it gets movement, but there's no weight. There's no weight. It's all lifted up by the water. All right, so I hope that helps a little bit for 22.